Thanks so much, Tom. It's wonderful to be here, and at the risk of letting this devolve into a mutual admiration society, I just feel so lucky that we've got your leadership at the university, your passion, your charisma, your great knowledge and expertise, and have this associated with this very important venture at the university in global health. It's also wonderful to be here in Somer Hall, and even better to have Al Somer here with us. I saw Al. There's Al. It's great to see you. And I should say, I saw Al this morning. We have meetings, I don't know, Al's about monthly, and invariably we get together over breakfast at Miss Shirley's, and it takes, I have a kind of a little game now that I'm sharing this with Al. He'll be able to game me in the way in which this game takes place. But it's when I sit down across the table from Al, the question is, how many minutes will pass before he starts making a case for some new global health initiative and seeking to push the university, push us all? You know, sometimes I have to tell you, Al, with his characteristic restraint and self-discipline, we can actually go a full 3-4 minutes before the topic comes up, and sometimes it's just in seconds. But this is the joy, Al, of breaking bread with you and having the opportunity to, again, be educated by you and hear your passion for global health. It's great. Martha, our Dean of Nursing, who's been such an important partner for all of us in the global health arena, and again, bringing great scholarly credentials and creativity and imagination to her leadership role. And it's wonderful that you're here. And then again, so many colleagues whom I've had the pleasure of being at conferences, seminars, workshops, more informal settings, traveling abroad with, and again, around global health issues, and of course, our great students. So thank you all for being here and for all the efforts you make in global health. This is a day, of course, that is about looking forward, but it also, I think, is worth every so often standing still for a moment and looking back. And in doing so, consider the following. 50 years ago, when the Johns Hopkins School of Public Health Department of International Health began, it was a much different world. One did not easily fly across the globe, a trip that now takes less than 24 hours, social networks. These were your family, maybe a few neighbors, your actual living friends, not hundreds of thousands of people you'd never met whose tweets would allow you to track the spread of flu. The people on the front lines, then, of global health were our doctors, nurses, and public health experts. Now, of course, some things never change. Our doctors, nurses, and public health professionals are still very much on the frontiers. Yet today, as we wrestle with the pressing challenges, the health challenges of the 21st century, from reducing core morbidity rates of HIV and TB to improving water safety, we're witnessing a shift away from exclusively health care-based responses. Our increasingly connected and more complex world requires cross-disciplinary solutions. They require us to marshal the strengths of doctors, nurses, and public health experts, but also political scientists, entrepreneurs, biomedical engineers, and dare I say, sometimes even lawyers. And I can think of no better reflection of this new landscape than the work of the students that we're celebrating here today. Consider the challenge of providing safe, effective care to women and families in developing countries. A quick tour of the students supported by the Center for Global Health reveals a budding biologist who went to Nepal, where she deployed her computer programming skills to maximize the quality of collection and processing of data on nutrition and the gestational size of infants. An otolaryngology resident who served as a resource-starved hospital in Cameroon to ensure children with cleft palates received high-quality care. And a group of undergraduates who spent intercession in South Africa conducting research that informed national level recommendations for strategic health planning on gender justice and HIV. Harnessing this multifaceted expertise to help individuals and to shape policy that will affect populations is not just an academic exercise. It is, of course, rooted in academics, but it is much more than that. And it is so because the stakes are so extraordinarily high. I'm gratified that Johns Hopkins is taking action daily with passion, with conviction, to translate our research and discoveries into solutions that attack pernicious problems affecting the health of communities around the world. Even more, I am proud that we're helping shape the future by training the next generation of researchers and clinicians, nurses, engineers, and business leaders. And thanks to the efforts of the Center for Global Health, its partners at Johns Hopkins and around the globe, the number of students supported by our established global health placements and research awards has roughly tripled since the center's inception in 2006. And I think that is a great way of evidencing the leadership of the center, but just the collective appetite, the passion for these kind of placements that is distributed so widely through Johns Hopkins. Of course, these opportunities are but one manifestation of the efforts underway across our one university to level the playing field in global health. The same spirit that drives our students and faculty today will be the bedrock of a new university-wide, cross-divisional initiative in global health. That's a mouthful, but it's an important idea at core. That is that we have identified a handful of signature initiatives that will drive philanthropic priorities during the next campaign, the capital campaign for the university, that will be announced in just about a month's time. And one of those signature initiatives will be in global health. It will bring together a range of disciplines to translate our basic science into novel treatments and interventions, to transform our investigations in political science and economics into effective policy that protects our communities, and importantly, to foster a pipeline of talent, like those of you who are in the room today, who will set a new standard for serving others abroad and at home. And this is something that has been percolating through the university for the last several years. It's involved endless discussions with a number of different faculty members, students, and other constituencies, but we now really feel that we're on the cusp of launching something very ambitious and very exciting for the future of the university. You know, it's important, I think, when you look at Hopkins, to see, as Tom mentioned a moment ago, this quite amazing, broad and deep imprint of our research across the globe. And of course, at the core of that is our faculty, that we have this wonderful cavalcade of stars, of people who have literally not just inhabited the field, but have defined the field of global public health, and they are here at Johns Hopkins.